I don't think the Pfizer one is the right choice for India. And I don't think India, that's why wisely did not invest in that sort of, buying that sort of vaccine.
I'm joined in this video by Dr. Nikhila Juvvadi. She's the youngest chief clinical officer in Chicago at 31. She's also heading a COVID task force at the Loretto Hospital in the city. So, Nikhila, thank you for joining us here on India Today. We've had many people who've gone through the process of vaccination, who've been vaccinated. This is the first time we're getting someone with us who administered the vaccine. And I think it's as important to ask you about your experience as much as it is to ask the people who got vaccinated. When we talk about Pfizer, there's been a lot of debate about it here in India. I'm not sure if you've been tracking it. It's about the fact that there's a bit of a challenge with regards to the storage of this vaccine because of the kind of extreme temperatures it needs to be stored in. Are you facing a bit of a challenge on that front in the United States?
Yes, we are. So it does need to be stored at minus 80 degrees Celsius, which obviously a lot of, whether even hospitals or any facilities do not have. So Pfizer has been shipping them in what we call ultra cold boxes. But even with those, you have to plan very, very carefully because you can only store them in those boxes for 30 days. Now, if you store them for 30 days and the second dose of the vaccine needs to be taken in 21 days, that means your window for giving the vaccine to hundreds of people is small. So that you either have to procure your own freezer or you have to figure out a mechanism where you can not waste any of the vaccine and give it to hundreds of people. So the logistics of planning this are very carefully thought out. And that's why it requires like a COVID task force and it requires a lot of thought and effort into it. We fortunately, at our hospital, we had an ultra cold freezer because we perform clinical research. So clinical research in COVID, doing clinical COVID research or vaccine research, we had it, but many, many other hospitals do not.
In your expert opinion, do you think this kind of a vaccine is something that's even possible to be used in India, considering our population, considering the rural parts of the country as well? Do you believe that this kind of a vaccine is even, feasible for India, or do we have to really look at other options?
No, I unfortunately do not believe that it is possible to get to the areas that you're talking about. I mean, I went to Bhaskar Medical College in Hyderabad. I know I've worked in those settings, and that type of logistics and preciseness that you need to get it to the rural areas in that time frame is a difficult thing. So when we talk about the next vaccine, which was just approved by the FDA in Chicago, in the US, which is Moderna, that's stored between minus 5 to minus 25 degrees Celsius. Okay, so that's even a little bit better. That might be even more possible. So more places will have that type of refrigeration. So that's something that's more easier. Now, the Oxford AstraZeneca vaccine does not require those sort of temperatures, just minus 4 degrees Celsius, which is, so I don't think the Pfizer one is the right choice for India. And I don't think India, that's why wisely did not invest in that sort of, buying that sort of vaccine. The indigenous grown ones that are getting done in India, I think are more probably suited to, the logistics of getting it done, or the British one or the Russian one. But I don't think the Pfizer BioNTech, unfortunately, is. But, we could start with the cities, starting with some of the healthcare workers in the cities is better than nothing at all. So if everything else is getting delayed, getting Pfizer or Moderna might be the best option.
The reason I ask this is because you've got so many countries now going ahead and approving vaccines. As you pointed out, in the US now, it's not just Pfizer, but also Moderna. So there is a lot of talk about it here in India, but when really we'll get a vaccine? And do you think that considerable amount of pressure could lead to also, a decision on Pfizer that could backfire also on India?
I don't see, that's the thing. I think that they should acquire a vaccine. Now, they should acquire it before. I don't think waiting until March is an appropriate timeline. I think whatever it is, whether it's Pfizer or Moderna or the Oxford one, they should acquire it before then and get started with any healthcare workers or essential workers, even if we don't reach all of the rural areas. Because if you wait until March to get it done, then by the time you finish the population, it's going to be into 2022. So better start with something and get the logistics behind it. I mean, the Indian government definitely has the ability to do anything, but you have to start with somewhere. And, I think getting some vaccine is better than none at all.
As far as vaccine distribution goes, is there also a challenge in the United States? Because here in India, we're talking about a very robust distribution plan. We're focusing on that a lot more even before the vaccine comes, because we know that's going to be perhaps the biggest challenge.
I think that's where India is doing the right thing, because in the US, there's two challenges. One is the distribution, which is fine because they planned to distribute while the vaccine was ongoing. But the other issue in the US is the fact that people have a lot of fear and skepticism. And in one thing about India that I know, it's not there so much. But in the US, due to the history of clinical trials and racism and so on, there's so much fear and skepticism when it comes to the vaccine that part is what we forgot. That's the part that the US is fighting about, and that's the 40%, you see in healthcare workers itself. So the fact that India is concentrating on distribution is a good thing, and the fact that they don't have to deal so much with, it's more they trust the doctors there, right? Like
blindly
that they'll do it, right? Exactly. So there is a little bit more. So I think in India, the government investing in buying the vaccine, whether it's cold, ultra cold, whatever it is, and doing a little more planning on that end will anyway benefit in the end, because what the saying is, it doesn't matter how many vaccines you have if it doesn't go into your arm. So in India, I know it'll go into their arms, so just get it, so that's the difference.
So, there's been a lot of talk about how India's handled the pandemic also. You've been in the United States. As I mentioned, you're heading a COVID task force. If you had to compare India and America, who do you think handled the pandemic better and why?
You're asking me to choose between.
I'm putting you in a spot, yes.
Putting me in a spot. So I will say, and I think I can say this very clearly, parts of the United States handled it very well. And parts of the United States did not handle it well at all. So, there are places, South Dakota, for example, is a state which has the highest death rate per capita in the entire world. And facts are facts at the end of the day. So, but then I also hear about weddings in India where people are 200, 300 people and 30 people get it. So both governments, I think, here the state governments, and in India, the federal government and the state governments did a good job of putting the rules down, I think. Whether the people themselves followed it, whether here in some states or back in India, depending on the elite, what they want to do, that sort of thing, I think is about the people. But I think the governments did a good job in certain areas to make sure that we did not have a horrific death rate in India, at least. So I believe that, there's good and bad in both.
Okay, so a lot of lessons to learn, no doubt. Before I let you go, Nikhila, we spoke about the apprehensions of a vaccine. The other challenge is that a lot of people will now start letting go, kind of, not following the necessary norms, not wearing masks, not maintaining social distancing, because they say that, hey, there's a vaccine now, we have nothing to worry about. How do you address that?
So that's the other thing. So unfortunately, with that mRNA vaccine, I did say it's safer, but unfortunately, you don't know if it's a type of vaccine that you could still have the virus. Let's say it's like having a glove on, right? If you touch the dust with the glove and you touch somebody else with that glove, they're still going to have dust on them. So just because you don't feel it. So if you have an mRNA vaccine, you might not get sick and you might be asymptomatic, but you still might be able to carry the disease to somebody else. We don't know yet to that extent. So that's why wearing a mask and social distancing is still something we have to do until we achieve, I know this is a word nobody really sometimes believes, but herd immunity at 80%. And in a country like India, that's a very heady proposition. I mean, how are you going to get there? That sort of thought process, it's going to take a long time, right? So we will still have to do those things. But if we can protect even enough people to not get sick, even if they're asymptomatic, if they don't get heart problems and lung problems and long-term problems from it, it's worth it to get the vaccination. So, again, something is better than nothing. And we want to go back to some sort of normalcy in this world.
So your message would be get the vaccine, but remain cautious despite that, right?
Absolutely.